Hello, everyone, and welcome to this month's Health Extension Advocacy Research and Teaching Initiative, Heart Bunch video. This month, we're really excited to introduce Heart and let you get to know us a little bit more and what we're doing in our communities. I'm going to get us started with a brief overview and tell you a little bit about what Heart does. So we partner locally, nationally, across the state and in our communities to talk about the opioid crisis as well as other pressing public health issues. We partner with researchers and community organizations, police departments, anybody and everybody who's willing to partner with us to make our communities a healthier place. Currently, I mentioned our focus is on opioids, but we also address other pressing issues such as vape prevention or suicide prevention. And we are housed in 9 different counties across the state. So we serve both rural and urban areas, as well as the state of Utah. So we're housed in Carbon, Emory, Utah County, Weber County, Davis County, Cache and Box Elder County, and Salt Lake and Tooele County. And we really hope that after we talk a little bit about our pillars and the things that we're working on, you'll want to partner with us. So I'm going to pass it to talk about prevention and education.
So prevention and education is our first pillar, and the Heart team provides evidence-based prevention education on a variety of topics, mostly health-based, so emotional health, physical health, wellness in general, and mental health, of course. So some of the examples of what we might do with prevention education are some mentoring programs with youth in the schools. We might do suicide prevention through a couple of evidence-based programs, and just general like diabetes prevention, other kinds of prevention education programs. If you know very much about health, you know that the best way to have an impact is to prevent problems before they begin. And so as an education agency, that's one of our main focus areas.
The next pillar is stigma reduction. Stigma can negatively affect individuals emotionally, mentally, as well as physically and otherwise, as well as the communities that individuals live in. So stopping stigma is a really important way that we can make communities both safer and healthier. And the Heart Initiative, some examples of some work that we've done related to this pillar is on collecting stories from people in recovery, individuals who are actively using substances, as well as family members. And we've done this in order to spread awareness and reduce stigma.
Okay, the next pillar is strengthening community ties. And strengthening community ties is really the process of connecting, establishing, and supporting coalitions and other stakeholder partnerships. Heart is currently partnering with health departments, research experts, community coalitions, and other stakeholders to coordinate on-the-ground efforts that evidence-based information, community-based solutions, and multi-sector partnerships can all contribute to. Our coalition partnerships continue to be strengthened with additional organizations who are working with on different initiatives and through various collaborative efforts. So there are many different efforts that we're taking to strengthen community ties, but a few examples are the Ogden Civil Action Network Partnership, Little Cities of Hope series, and the Carbon and Emory Opioid and Substance Use Coalition.
And I'm going to talk about harm reduction. Harm reduction refers to a set of practical strategies aimed at reducing negative social and physical consequences associated with drug use. Harm reduction strategies aim to minimize negative impacts, such as injury or death, associated with engaging in certain behaviors. Examples for the Heart team include supporting suicide prevention programming, treatment facility curriculum creation, and supporting naloxone use and awareness.
And then last but not least, we're going to talk about resilience building. So early part of 2020, we got together and we decided to add this as a new pillar. And therefore, we had combined stigma and harm reduction into its own pillar. We combined those two together, even though today we're kind of talking about them separately. But as far as resilience building, really what resilience is just being able to adapt well to adversity and trauma, different threats or significant sources of stress. So the Heart Initiative promotes emotional and physical resilience through evidence-based practice. So some of those examples is conducting evidence-based resilience courses, series based on resilience, doing stress management, coping education, even working with youth in developing, different life skills, and working with youth and adults, and maybe some self-management, developing those self-management skills.
We hope that this has introduced you to some of the many things that we do as the HEART Initiative, and want to say thank you to all of you, our community partners, our stakeholders, and everyone that makes HEART a success. And visit us on extension.usu.edu/HEART, or follow us on social media to stay connected. And we hope to see you again soon. And here's a little brief reference of our annual report. Thanks, everybody.